Quick Service Restaurant Reopening Safety 101. Achieving Social Distancing Goals Without Reducing Seating. Presented by HESS Advanced Solutions. Fast food restaurants are taking measures to provide low-contact service for guests and team members. Although the CDC, FDA, and USDA report low risk of COVID-19 transmission by food or food packaging, what are the risks to servers? Employees report feeling vulnerable to COVID-19 working the drive-thru because it necessitates being too close to co-workers and customers to meet social distancing guidelines from health authorities. In a small space of about 6 feet by 6 feet, there are as many as 5 people working. Employees feel they can't quit their jobs working at the drive-thru, even though they are uncomfortable being in close proximity to colleagues and customers. They weigh risking their lives to serve food during the COVID-19 pandemic against risking losing their homes if they don't. The National Restaurant Association has published a reopening guidance on social distancing. They recommend limiting contact between waitstaff and guests. If practical, physical barriers such as partitions or plexiglass barriers at registers are acceptable. Use technology solutions where possible to reduce person-to-person interaction. Negative building air pressure is created by powerful kitchen ventilators needed to clear the work area from smoke and grease. Even with sneeze protection barriers, the kitchen ventilators draw the air from the customers toward the counter staff. The drive-thru window acts as an outside air intake while the window is open. Once closed, the air drawn in by the kitchen ventilator stops flowing, allowing the contaminated air to linger at the workstation. Drive-thru windows with heated air curtains draw air from above the vehicle and blow it directly down on the server. Separated by plexiglass. Will restaurants be adopting this setup in the future? It's unlikely that methods such as this will be effective as infectious clouds travel above and across barriers. Watch this.
One of the top questions we see from you, how does the coronavirus spread? Scientists are revealing new answers every day. The main method is when an infected person coughs or sneezes, sending out droplets into the air. Early research showed those droplets could travel up to 6 feet, but a new group of researchers thinks it could be even further. Take a look at this. This is a model they created that shows what happens when you cough in a place like a grocery store. Look at that. Look at how the cloud spreads. The researchers say an infected person could cough and walk away, but they leave behind small particles carrying the virus, which can end up infecting others. And those particles can live in the air for a while. Researchers at the National Institutes of Health, the CDC, UCLA, and Princeton found the virus can live in the air for about 3 hours. On plastic, it can live for 3 days. The same with stainless steel. On copper, 4 hours, and on cardboard, up to 1 day.
The NRA recommends updating floor plans for common dining areas and redesigning seating arrangements to ensure at least 6 feet of separation between table setups. This will require closing tables, booths, counter seats, and turning guests away. Even with reduced staff and food purchases, this will result in drastic reductions in revenue. The VidaShield UV24 system uses UVC and filtration to draw in and treat environmental air. UVC has been shown to kill SARS-CoV-2, the virus that causes COVID-19. When exposing microorganisms to UVC light, the light penetrates through their cell wall and disrupts the structure of their DNA molecules, prohibiting reproduction.
Really heavy particles like fungal spores will not be in the air as long as a really light particle like a virus. We know that studies done in major cancer centers have shown that the particles are most disturbed when the room is being cleaned, and that some of the biggest risks, or the greatest risk to the patient, is putting the patient back in the room after the room has been cleaned and all the particles are stirred up. In many regulatory settings, such as OSHA or EPA, there are regulatory controls, and there's a thing called the hierarchy of control. And most people would agree that the highest step on that is to have an engineering control. And by an engineering control, I mean a control that takes care of the hazards in the environment without requiring human intervention. So in the case of a VidaShield unit, the unit goes in the ceiling, it draws the air in through a MERV 6 filter, through a series of fans, passes over the UVC or the germicidal bulb, and then it goes back into the room. No one has to touch the unit to make it work.
The size of this typical restaurant floor plan is 1,084 square feet. The configuration accommodates 82 patrons. The red squares represent open tables. The blue circles illustrate the 6-foot social distancing guidance recommended by the National Restaurant Association. Adjacent tables within the 6-foot radius need to be closed to conform with the NRA guidance. Of the 82-seat capacity, 34 must be closed. This represents 41% of the available seating. VidaShield will sanitize the air, removing 93% of the coronavirus at a rate of 50 cubic feet per minute. One unit will sanitize 271 square feet every 43 minutes. A restaurant of this size and configuration will require 4 units to achieve 93% zonal protection every 43 minutes. Units can be installed in the ceiling or suspended and can be configured to match the restaurant's aesthetics. Some restaurant owners prefer the units to be conspicuous, so guests can see visible evidence that their health is being protected.